Frostbite. What is a frostbite? It is a condition in which skin and underlying tissues freeze after being exposed to very cold temperature. It usually affects small exposed body parts like fingertips, toes, earlobes, cheeks, chin, and tip of the nose. Early signs and symptoms of frostbite are patches of reddish skin and burning pain. The condition then progresses to cold, numb, or white and grayish skin that feels stiff or looks waxy. Small blood vessels supply your skin, which has many distinct layers of cells. When exposed to cold temperature, your blood vessels constrict or become narrow to divert the flow of blood away from your extremities, such as fingers and toes. This helps to maintain your core body temperature. Over time, the lack of blood flow to these areas can damage your skin and nearby tissues. Treatment of frostbite. Seek medical attention as soon as possible. Get them into a warm room or shelter. Remove any wet clothing. Warm them under dry layers of blanket and clothing. Place areas affected by frostbite in warm to touch water. Things not to do. Unless necessary, do not walk on feet or toes with frostbite. Do not use a fireplace, heat lamp, radiator, or stove for warming. Do not use a heating pad or electric blanket for warming. Do not rub or massage areas with frostbite. Prevention. Be sure to follow the tips below to prevent frostbite. Be aware of the weather forecast. Avoid spending long time in cold weather and coming into direct contact with metal surfaces or water while out in the cold. Dress appropriately for the cold weather. Wear things like mittens or gloves, hats that cover your ears, scarves, sunglasses, or ski masks. Outer garments should be waterproof and windproof. Change out of wet clothes as soon as you can. Stay hydrated and eat nutritious meals. Avoid alcohol as it can make you lose body heat more quickly. Be able to recognize the signs of frostbite. Remember that frostnip is the precursor to more serious frostbite. If you or someone else appears to be developing frostbite, seek warmth and medical attention as soon as possible. Frostnip. It is the first degree of frostbite. Signs and symptoms. It is very mild because it freezes only the outer layers of skin. It is caused due to the exposure to extreme cold or due to the exposure to cold metal or liquid. The skin is waxy but not rubbery because deep layers of skin are not affected. The skin may turn reddish, and numbness and prickling sensation can also be experienced. Treatment. Prevent further exposure to cold by moving the affected person from cold environment. Remove shoes and wet socks and dry their feet. Rewarm the affected area by soaking the affected area in warm water for 15 to 30 minutes. Avoid using heat sources such as stove or heating pads as they can lead to burns. Contact with warm objects such as hands, breath, etc. On rewarming, pain or tingling sensation can be felt. Over-the-counter pain medication can be taken to ease any discomfort. Superficial frostbite. It is a second-degree frostbite. Signs and symptoms are skin turns from a reddish color to a paler color. Sometimes it may also appear blue. Ice crystals may form on skin. Hard or frozen feeling is felt when you touch the affected area. Treatment. Your skin may feel warm and swelling can be seen. Rewarming should be done as soon as possible. Pain medication can be taken to ease any discomfort. After rewarming, wrap the injured area in order to protect it. Intravenous fluids may also be given to keep you hydrated. When to seek a doctor. Seek medical help if you see fluid-filled blisters, blue or purple coloration, swelling, and a feeling of burning or stinging sensation in the affected area. The blisters need to be drained. If any blisters appear to be infected, the doctor will prescribe a course of antibiotics. Many people can recover fully from a superficial frostbite. New skin will form under any blisters or scabs. Some people may have permanent problems that can include pain or numbness in the frostbitten area. Deep frostbite is the third degree of frostbite, and it is the most severe stage of frostbite. Skin may appear blue or look splotchy. Numbness can be felt. Muscles close to the affected area may not work properly. blood-filled blisters may develop. Treatment. Deep frostbite requires immediate medical attention. Like the treatment for superficial frostbite, your doctor will rewarm the area. They'll give you pain medication, wrap the area, and may provide IV fluids. Clot buster can be given to help improve the blood flow to the injured area. After rewarming, the area will appear black and feel hard due to tissue death in the affected area. Follow-up. Your doctor may wait for several weeks after your frostbite injury in order to determine the full extent of the damage. In some cases, a procedure or surgery may be required to remove the dead tissue. For example, a severely damaged toe by deep frostbite may need to be amputated. Some may have lasting problems such as pain or numbness, or increased sensitivity to cold environment in the frostbitten area.